the UN Secretary General said that global efforts to date have been insufficient to deliver the change we need, jeopardizing the agenda's promise to current and future generations. And due to COVID-19, an unprecedented health, economic and social crisis is threatening lives and livelihoods, making the achievement of the goals even more challenging. Under SDG 3, good health and well-being, there has been some progress. Maternal mortality fell by 38% between 2010 and 2017. However, on average, the global maternal mortality ratio declined by 2.9% each year over that period. That's less than half the rate needed to achieve the SDG target by 2030. Every day in 2017, more than 800 women died from preventable causes related to pregnancy and childbirth. Sub-Saharan Africa and Southern Asia, where most of our CADA member organisations work, accounts for about 86% of maternal deaths globally. Similarly, over the past 2 decades, the world has made tremendous strides in reducing child mortality, but still some 5.3 million children died before reaching their 5th birthday in 2018 alone. Sub-Saharan Africa remains the region with the highest under 5 mortality rate. In 2018, 1 in 13 children died before reaching age 5. That's 16 times higher than the average in high-income countries like the UK and Ireland. In many other areas, and especially now with the impact of COVID, we're facing a period of huge uncertainty. Hunger is predicted to double in 2020. The number of people in absolute poverty is expected to increase for the first time in 20 years. And according to a recent report, vaccine coverage has been set back 25 years in just 25 weeks. Our CADA member agencies work with some of the poorest and most vulnerable communities in the developing world, and those communities will be the most adversely affected by these setbacks. We must all together renew our commitment to the SDGs and redouble our effort to regain the ground lost during this coronavirus pandemic. CADA members are certainly committed to doing that, and we commend everyone attending this conference for all your work towards a healthy people on a healthy planet. Thank you. And before I hand over to our moderator for this session, a few housekeeping points. To make the most of the session and ensure it runs smoothly, please just type any questions you have in the chat box. We'll also open the floor to the audience at the end of the session. The sessions are being recorded, and by joining the conference, you're giving us consent to record these sessions. Live streaming is available right now on the Irish Global Health Network YouTube channel. CPD, Continuous Professional Development Certificates, will be available for attendees on request. Please email us if you require certification. For those who do request CPD, attendance will be monitored, so please make sure you keep your Zoom call on for the duration of this session. So now let me introduce the moderator of this panel discussion, Kieran Mooney. Kieran is a final year medical student at Queen's University Belfast, and having completed his Masters in Global Health at Maastricht University, he's now part of the student outreach group at the Irish Global Health Network. I hope you have a really good session. Over to you, Kieran.
Thank you, Peter, for that introduction, and also to CADA for their support of this conference and their continuing collaboration with the Irish Global Health Network. And we're also really looking forward to CADA's One World Festival, which, like so many other events this year, is going to be online for the first time. So a very warm welcome to all of you joining us from across the globe to this session on the Sustainable Development Goals 5 years on, a way forward. Set by the United Nations in 2015, the Sustainable Development Goals were heralded as the blueprint to achieve a better and more sustainable future for all, addressing challenges in poverty, inequality, climate change, environmental degradation, peace, and justice. This morning, we've heard from so many of the complex challenges and hard-won successes along the road to achieving the SDGs, from our colleagues working in planetary health, child and maternal health, migrant health, and in global health governance. On the back of that, this session discusses the way forward in tackling those issues which are crucial to achieving the SDGs by 2030. Our expert panel will discuss broad topics, including the role of nurses and community health workers in achieving those SDGs, the continuing burden of non-communicable diseases, most particularly eye health, planetary health, and also sustainable global health governance. So on that note, it gives me great pleasure to introduce our first speaker this afternoon, Professor Claire Gilbert. Claire is an ophthalmologist and Professor of International Eye Health at the London School of Hygiene and Tropical Medicine. Professor Gilbert has been undertaking research into blinding eye disease in low and middle income countries since 1990, with a focus on children's blindness, as well as leading multiple national and regional workshops on public eye health and retinopathy. She is a technical advisor for a number of large organizations and has published over 350 peer-reviewed papers, winning several awards for her work on blindness prevention. Professor Gilbert, we're very grateful to have you and share some of your thoughts on this important topic today.
Thank you very much. It's very nice to be here, and it's a pity that I'm not with you in person. Do you want me to share my screen?
Yeah, you can do, go ahead.
Well, thank you very much. Today I'm going to cover where we are now, the impact of visual loss on the SDGs, the challenges ahead, and what I see as the way ahead for eye health. Quickly, some definitions. You're probably all familiar with a visual acuity chart. If you can see the rows at the bottom, that's 612 or below, that means you're not impaired according to the WHO definition. If you can't see the rows above, that means you're visually impaired. And if you can't see the top letter at 3 meters in your better eye, that is the definition of blindness. I'm quickly just going to cover the major causes of avoidable blindness globally. The top 3 fall into the group where there are sight restoring interventions, and the bottom 3 are chronic eye diseases where their management is much more difficult because people require early identification, interventions, long ongoing care, and it's much more resource intense. So cataract surgery is a very quick procedure, it's highly cost effective, and tens of millions of cataract operations are done every year. And it's said to be the most frequently performed of all surgical interventions. Refractive errors can be corrected by a pair of spectacles, again, highly cost effective, but people who have spectacles also need ongoing care to replace their spectacles. Glaucoma requires early intervention to prevent blindness, and diabetic retinopathy and age-related macular degeneration similarly are diseases that need interventions early to prevent blindness. And these are data from the analysis of the Global Burden Diseases Visual Loss Group for this year. These data have not yet been published. They will be published in the Lancet Commission, and so the findings are embargoed for the time being. This is the number of people who are blind by cause in every million population in the different global burden of diseases regions. And you'll see that there is almost a tenfold difference between the most affluent regions at the bottom and the poorer regions at the top. So the difference is largely explained by differences in demography, but particularly by variation in access to care for the sight restoring procedures, which are the cataract and refractive errors, which are the green and the orange bars, and also inadequate management of the chronic eye diseases, which are the red and the brown boxes. The light green on the right are other causes of visual impairment, some of which are avoidable, but many of them are not. So the total number who are blind globally is 43 million, and another 55 million are visually impaired. So that's almost 100 million. The causes of visual impairment are similar, but the balance is different. Refractive errors are more important than cataract. In addition, there's about 500 million people who need correction for near sight loss, and there are many, many more millions who need ongoing services for refractive errors. So this means about 1 billion people, or 1 in 8 of the world population, need eye care. So over time, a lot has been achieved, particularly since the launch of Vision 2020, the right to sight in 1997. And this has led to a falling prevalence of blindness in many countries. But because of population growth and aging, the numbers are continuing to rise inexorably. In all populations, there are groups of individuals who are marginalized and have a higher prevalence of visual impairment and blindness. And this is because they're more likely to become blind, either because they are exposed to risk factors or those risk factors are not well controlled, such as poor control of their diabetes, for example, or they present too late for anything much to be done. And they remain blind because of poor access to care. And this is a really major issue in the poorer regions of the world. The global burden of diseases analysis shows that 55% of women globally, 55% of the people who are blind globally are women. And these are the other marginalized groups, which do vary from population to population. However, if we just think about women on their own, this actually underestimates or doesn't really identify the populations most at risk. We've undertaken national blindness surveys in several countries in Pakistan, Sri Lanka, and Nigeria, and we've analyzed the data combining different social axes. And what we found in the Pakistan National Survey was that rural illiterate women were 22 times more likely to be blind from cataract than urban literate men. The findings were similar in Nigeria, so a 7-fold and a 5-fold difference, respectively. So this really shows that one has to use multiple social axes to identify the marginalized groups. In terms of the impact on the SDGs, if you look at 8 and 4, decent work and economic growth and quality education, trials done by the group in Belfast have shown that tea gatherers, for example, in India, earned much more money because they were able, when given a pair of spectacles, because they were able to pick more tea because they could see better. And the quality education, that was a trial in China, which corrected myopia, which is the commonest refractive error, and that showed that children who could see better performed better in maths. The poverty box, we did a study in Bangladesh, Philippines, and Ecuador, which was a case control intervention study of cataract surgery. And what that study showed was that households who had a cataract blind individual were poorer than control households. And after surgery, the household economic status went up to the same as the control households. And this was maintained at 6 years. For the Lancet Commission, our group has done rigorous systematic reviews to address all the different SDGs. And it shows that beyond these direct impacts of good health on the SDGs, there are also a range of other indirect effects. There is evidence that poor vision, if you look at box 3, is associated with anxiety and depression, social isolation, more falls and fractures, more road traffic accidents, and poorer control of chronic diseases. So improving vision is also likely to have large impacts beyond the health sector. The main challenges ahead, as I see them, is that the need is going to continue to grow as populations continue to increase and to age. And as a result of innovation, there are more conditions which now can be managed, which they just couldn't be 10 years ago. And I expect this is going to be the same for other conditions, which at the moment, we don't have very good management options for. This will then increase the number of people who have the potential to benefit. Because of aging, chronic eye conditions are increasing, and these are particularly challenging. They're more resource intense. They require more equipment, more people, and they require the adherence to patients to their ongoing care, which can be really challenging in low-income settings. But most importantly, probably, many countries, low-income countries, do not include eye care in their national strategic health plans. And this means that eye care falls below the radar, and in many countries is seen as the domain of the non-government sector, which in countries such as India can be very strong and provide a high proportion of eye care. But despite that, government services are very important for the less well-off. They provide coverage across the country. And so not having eye care included in these plans, I see as being a big current problem. And we also need evidence on how to increase access to marginalized groups. This is badly needed. We did another systematic review of interventions to improve access to cataract surgery, the commonest cause of blindness, and we found only 2 trials, and that was the only evidence that there was. So we really badly need evidence on how to address marginalized groups. So the way I see it is that business as usual is not enough. We have managed to reduce the prevalence of blindness, but the numbers are still growing and they're going to continue to grow and impact on the SDGs. We need different approaches to delivering eye care, and eye care is really very innovative. We have come up with lots of technologies. There's more on the horizon. I think artificial intelligence will be a game changer for many chronic eye diseases in terms of diagnostics and providing objective ways of following patients up to see if their disease is progressing or not, as well as task sharing. So for example, in the United Kingdom, many of the injections of the biologicals into the eye is now done by nurses. All our diabetic retinopathy screening in the UK is done by non-medical personnel. So we need to embrace these, get evidence that they're safe, effective, and work, and what the regulatory frameworks are before they can be scaled up in other settings. I've already mentioned interventions to increase access, and private-public partnerships. I also think, certainly in many low-income countries, there is more skilled expertise in subspecialty ophthalmology than in the government sector, and creative ways need to be seen how these can be scaled up, bearing in mind the important need for robust regulatory frameworks so that they are not abused and cause harm or overtreatment or overdiagnostics to patients. But I think the key way ahead is for scaling up services is that eye care and eye health is integrated into national policies, planning and delivery. And the way that this can be achieved is by ensuring that eye care is a component of universal health coverage, and that eye care is included in national strategic health plans alongside other conditions. Many countries have national prevention of blindness plans, but they're separate and they're not integrated into other policies. So that means when countries are doing their health workforce planning, for example, eye care does not appear on the radar. And one thing that you may not be aware of is that eye departments are often the busiest outpatient clinics of any speciality. And if eye health is not included in national health management information systems, this great level of need will never be recognized and the impact of delivering services can't be monitored. So including eye health in national strategic health plans is incredibly important, and we'll need advocacy with Ministry of Health. In response to this, the WHO Prevention of Blindness Group are developing essential packages of eye care, which will be made across a range of eye diseases, the ones I've mentioned, but also others. And they outline the resources, human and otherwise, that are required. They come up with a budget, and they are also working on key indicators to use in the health management, national health management information systems to track delivery of services. And to my knowledge, 2 countries in Africa have already done this, Nigeria and Kenya. And it'll be very interesting to see how that pans out and whether that does lead to improved services, better access to services because they're better distributed, and ultimately a reduction in visual impairment and blindness, which will help to contribute to their SDGs. Thank you.
Thanks, Claire, for that amazing presentation. And thank you for highlighting the fantastic international work that's going on in eye health that I'm sure a lot of our audience today weren't aware of. I was particularly taken back by how many of the interlinking aspects of the Sustainable Development Goals, something like good vision, which us in the Global North take for granted, can affect those goals. And that fact that you mentioned about rural illiterate Pakistani women being 22 times more likely than men in urban settings is shocking. So your presentations really highlighted the need for all of us to sort of continue to reach out to those marginalised groups, so the women, the poor, the disabled, and ethnic minorities, like we've heard this morning as well, in sort of all aspects of our global health work and advocacy, particularly if we hope to achieve the SDGs by 2030. So thank you very much, and I'm sure there's some questions coming in which we'll address at the end of the session. So our next speaker is Dr. Renzo Ginto. Renzo is Chief Planetary Doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet. Renzo, an Obama Foundation and Asia Pacific leader, received his Doctorate of Public Health from Harvard University for his dissertation on climate smart health systems in Filipino coastal municipalities. He is an advisor to the Forum on Climate Change and Health at the World Innovation Summit for Health, the editorial board of the Lancet Planetary Health, and the Lancet One Health Commission. For those of you who have heard Dr. Ginto speak before, you'll already know how inspiring he is. And Renzo, we're absolutely delighted to have you with us today. Sorry, I've just got a message. Renzo's just been kicked out of the Zoom. So Hala, if you can let him back in, if that's possible.
Okay.
Claire, perhaps just while we're waiting on Renzo coming back in, you'd mentioned some of the technologies emerging in eye health, and especially in international settings. Do you want to sort of briefly mention a few of those? I'm sure some of us are aware of sort of screening tools for eye disease on smartphones and stuff, but are there any more sort of innovative ones that are coming to practice? Oh, you're on mute.
There's a laser technology called OCT, which is absolutely phenomenal. The laser light can pass through opaque tissues, and it gives you a sort of histological section of different structures in the eye. And I think that's going to be a game changer in many ways. Imaging is also phenomenal. I think artificial intelligence is also going to be extremely important for diagnosing conditions like glaucoma. I showed those photographs of the optic disc. And at the moment, you eyeball it. You look in the eye and you eyeball it. And there's also, there have already been studies done that show that artificial intelligence is very good at identifying those kinds of changes. And particularly for tracking progression, the reason why you get that appearance in the optic disc is because of the nerve fibers are dying. And if the pressure in the eye is too high, those nerve fibers continue to die. If you lower the pressure, you can hold it. And so having an objective way to see whether the disease is progressing or not would be extremely useful. And the eye is also a very accessible organ. There's all sorts of nanotechnology innovations in terms of drug delivery systems and so on and so forth. So there's a lot going on.
Great. And I think Renzo has now rejoined us. There we go.
Hello, everyone. Thank you for having me in this conference. Can you hear me very clearly, Kieran?
We can, yeah.
Wonderful. And, you know, shortly before I'm about to speak, my Wi-Fi connection became unstable. I think someone is trying to sabotage my presentation because I'm actually going to raise some really provocative ideas in this panel. Thank you again for having me here. And I'm speaking right from the Philippines, many, many thousands of miles away. And I'm not sure if our Irish friends have heard of this. I've told some of you in a previous webinar that I got involved in by the Irish Global Health Network. The Filipinos are usually called the Irish of Asia because one, like Ireland, we're a very Catholic country. But number two, like the Irish, we're scattered across the world. You know, we're a country of migration and diaspora. And so I have a very, special bond and feeling towards the Irish. I've never been to Ireland, though. Hopefully, after this pandemic, we can have this face-to-face conversation in Ireland. So again, thank you very much. And I don't have slides. I have ideas and remarks. I've tried to contemplate on the theme of this session about the way forward. You know, SDGs, 5 years have already passed by. We only have 10 years remaining. So what is the game plan? What should we be actually doing with the limited time that we have? 10 years is not a long time frame. And I want to start by reminding us all that, and I wrote it here in my notes, the story of 3 deadlines. And I know a lot of my fellow students here in the room, we hate deadlines. Deadlines for, assignments, papers, thesis, etc. We hate deadlines, but there are 3 deadlines that we cannot escape from, away from. The first deadline is the COVID deadline. And the deadline for COVID, for overcoming COVID, of course, it's as soon as possible. But although we know that as soon as possible may mean next year, maybe in 2022, until that holy grail that is the vaccine has not just been discovered, but released to the market. And so that is the first deadline that we should be thinking about. Of course, the second deadline is the Sustainable Development Goals, 2030. So that means we have 10 years or less than 10 years remaining. We're already almost, past halfway the year 2020. And so it's, again, as I've said, it's not a very long period of time, trying to achieve 17 goals, 169 targets within a span of 10 years for an entire planet of almost 9 billion, 200 countries with finite resources, at least financially. And then third, we have the other deadline of the climate emergency, climate change. The United Nations IPCC has already given us this deadline. By 2030, we should have actually not just gotten our acts together, but really prevented the breaching of the 2 degrees Celsius target, for, in terms of the allowable increase in average global temperature. So we have 3 deadlines and very limited time. What do we do? And I've been contemplating, okay, I can give a presentation about the technical fixes. We need to implement this and, invest in these inputs, etc. But I think fundamentally what needs to change is our mindset. The mindset that drives, our actions, whether it's related to COVID or the achievement of the SDGs, or protecting the climate in the long run. And, I've been also reflecting about the significance of these deadlines to my country, the Philippines. And the Philippines is a country that actually may find it hard to reach a lot of these deadlines. When it comes to COVID, we are now the top notcher in the Southeast Asian region in terms of number of COVID cases, 300,000 already. And we've even beaten a country as twice as big as us, which is Indonesia. The Lancet 2 days ago ranked us 66 out of 91 countries in terms of the effectiveness of the COVID response. Not a very good news to hear. When it comes to the SDGs, we have lots of shortfalls in many different aspects of health, for example. We've not achieved even the goals for maternal health, child health, infectious diseases like tuberculosis. These goals have been existing in the Millennium Development Goals that expired in 2015. And then now we're given much more goals and targets to achieve with only, as I've said, a 10-year time frame remaining. So a lot of shortfalls, and this is not acceptable for a middle-income country that is expected to be one of the top 20 largest economies in the world in the next 10 years. So that is the situation of the Philippines when it comes to the SDGs. And finally, climate change. My country is at the heart of the climate crisis. In some parts of the world, climate change is still about dehydrated polar bears, ice caps melting, something that will happen in the distant future. But for a country like the Philippines, alongside its neighbors in the archipelagos of the Pacific, these climate effects, especially on health, are already a reality, with sea level rise leading to salinization of drinking water, to increase in climate-sensitive infectious diseases, dengue, leptospirosis, etc., diseases that may be unfamiliar to our friends in the Ireland. But also now, I think, and it's just remarkable that climate change is now starting to really manifest, even in the United States, with the wildfires in California. A few months ago, we already saw a sneak preview of that in Australia, down south. And of course, in Europe, the effects are also quite different, with heat waves during summer and changes in pollination patterns, leading to also changes in the patterns of allergies, the seasonality of allergies. So these are all real issues related to climate change happening in the age of COVID, with SDGs as a big set of targets that we need to achieve. So what is the mindset that I'm referring to that will be required in order for us to really think more creatively, even imaginatively, in trying to address all these issues happening at the same time and accomplishing multiple goals at the same time? And I have just 3 main points. And these 3 ideas are ideas and concepts and principles that really animate my work now here in the Philippines. I returned shortly before the lockdowns have occurred in February. I graduated from Harvard virtually, never got to attend a physical graduation. And I'm here in my country, in the middle of the pandemic, trying to help in the response, but also in the long-term recovery and the preparation of the country for these deadlines that we're talking about. Philippines in the post-COVID future, Philippines in the post-SDG era, and the Philippines in, well, I don't want to say post-climate era, but maybe the era where we've actually triumphed in stabilizing the climate for our generation and the generations that are yet to come. So what are these 3 principles? One is planetary health. And I believe, Kiara, this morning, you already had speakers who talk about planetary health. I'll not expound, but as we know, planetary health is really the reinvention of public health. Public health for more than a century has added 25 years to the average life expectancy of the world, but at the expense of the planet. We've put food on the table, brought electricity to our healthcare facilities, created cities that improve access to, employment and other important life necessities. But again, at the expense of the planet, with forests destroyed, with air being polluted with, a cocktail of noxious gases and other pollutants, and oceans already, overfished and now also suffering from ocean acidification and increased heating. So we need an integrated approach. We need doctors who treat not only human patients, but also the planetary patient, which is planet Earth. And this requires transdisciplinarity and a systems approach. This morning, I was just talking to an engineering university, and I was talking about planetary health, and they're all wondering, we're not a medical school. Why are you talking about planetary health? The health of people and the health of planet are so important to be left to doctors alone, so like me, We probably will be treating the symptoms of the patient, but ultimately what we need is planetary prevention or prevention on a planetary scale, and that requires transdisciplinary approach. Planetary health is the arena for that. The second idea that animates my work, which also links to planetary health and the deadlines that we have been given, is this idea of decoloniality. I saw in the chat box someone shared my article about decolonizing global health. For the past several years, that has been a big discussions, definitely intensified by COVID-19. How do we decolonize the field of global health? But actually, it's not just global health that we need to decolonize. We need to decolonize our economy, our mindset, our treatment of other people, along many different lines, gender and race. So the racial injustices that are now being highlighted in the United States is just a continuation of this decolonial project. And ultimately, I think the biggest colonialism that we need to stop, that we need to overcome, is colonialism of humanity over nature. This idea that nature, the earth, is something that we own, instead of us just being part of this beautiful fabric that is planet Earth. This is the biggest mindset that needs to change. And in fact, it's tragic because it's colonialism over something that really provides us nourishment. The giver, which is again Mother Earth, planet Earth. Again, colonialism to the highest level. We need, and I think that is very closely related to the idea of planetary health. And then finally, and again related to planetary health, this idea of futures thinking. And I've always wondered, why are our global curricula, from elementary school, grade school, until college, we have classes in history. We learn about Irish history, Philippine history, the world history, but we never spend time inside the classroom talking about the future, talking about and learning about and experimenting about something that is actually something we can create, something we can shape. And we've relegated the idea of the future to mathematical models and 3-year strategic planning. But when in fact, the future is something that is within our reach, something that is within our fingertips, and this is something that we need to really be talking about and intentionally. And there's one book that was just recently published. It's called The Good Ancestor by Roman Krznaric, and I was so fascinated by the book. It talks about the need to really break this cycle of short-termism. Our governments we elect our government officials every 2 years, 3 years. The budget cycle is around a 1-year cycle or routine. But then how can we become good ancestors to people, to generations to come 100 years from now? And what we want is the young people of 2120, that's 100 years from now, will look back to us and say that the COVID generation of 2020 were good ancestors because they made decisions that did not only consider themselves, but also the health and the future health, the future health of that generation. So, planetary health, decoloniality, futures thinking. I think these are just some of the many ingredients for a much better post-COVID, post-SDGs, and a climate stable future. So looking forward to a conversation later. Thank you, Karen, and thanks to all.
Thank you, Renzo, for that really vibrant presentation. You've raised some really important and topical discussions, not only around climate change and future thinking healthcare systems, but also these issues of decolonizing global health, which, as you say, has become sort of a hot topic in the past year. I think we can all learn some important lessons in taking lead from whether that's local communities or the planet. And for those of us in the global north, about not enforcing sort of our ideals of what global health and planetary health looks like. And I really like that phrase that you used about public health being the extension, about planetary health being the extension of public health. And it's really fundamental to what we're sort of discussing today. So thank you, Renzo. Our next speaker is Judy Canyola. Judy is a community nurse and midwife and a renowned African nursing leader. She has over 25 years of experience in clinical nursing and education programs, and she has led HIV programs with both NGOs and the public sector. She has worked across with ministries of health in multiple countries across East, West, and Southern Africa. And Judy is currently the African representative for Nursing Now, the global campaign to raise the status and profile of nurses and midwives worldwide, particularly during this year of the nurse. Judy, it's very good to have you with us, and we're looking forward to hearing what you have to say.
Thank you, Kieran. I'm going to share my screen if that's okay. Have a quick presentation. And I'm very happy to be here this afternoon. For me, it's afternoon. It's 4:20 in the afternoon, and glad to just be part of these conversations that are happening around us and to contribute a little bit to thinking and information across the global north and the global south. I hope you can all see my screen.
Yeah, we can see it, Judy. Yeah.
Great. So I'm going to talk about how the SDGs can be met in the next 10 years. And my field of expertise is nursing leadership, which I'm going to focus on in terms of what we can do, just give us a little bit of thinking around some of the things that are happening. I'm going to specifically talk about Africa because I am African from Africa and working with my people here in this part of the world. So very, very briefly, because this is information that's in the public domain, when we look at SDGs in Africa, Africa unfortunately continues to lag behind most of the world. And more than half of the global poor are found in Africa. 1 in 3 Africans is at risk of food insecurity. With 10 years, actually now less, 9 years maybe and a couple of months to go, Africa is relatively on track to meet only 3 goals. The SDG 5, which is on gender equality, SDG 13, which is on climate action, which I really loved in the previous panel that they talked about climate. It was really, really interesting for me to hear what's going on because climate issues in Africa often tend to be are not a high priority. And then SDG 15, which is looking at life on land. Otherwise, in most of the other things, in some of them, in fact, we are stagnating in many of the other SDGs. When we look at achieving the Sustainable Development Goals in Africa, nowhere is the need greater than here in Africa. And while we have progress in some areas, still we need to do a lot more. And to be successful, we need to have effective coordinated partnerships and very important to domesticate the SDGs. So therefore, actually to fully transpose the SDG ecosystem into Africa and through some of the mechanisms. I'll talk specifically here about the AU, the African Union Agenda 2063. And although we've made some progress in some of the areas, it's been uneven, both across countries and even across the different 17 goals. And this is often been hindered by lack of national and local government coordination, and also sometimes the global system that Africa unfortunately finds itself in a subservient position at large. So far, our progress, as I've said earlier, has been significantly short. And when we look at the Africa SDG Index and dashboard of 2019, Mauritius has been the highest, only at 66.19, implying that we're only 66% across the 17 SDGs. And other top performers include Botswana, Ghana, and Rwanda, which is the country, I'm from Kenya, but I work in Rwanda. And I'll talk more about Rwanda in this presentation to use it as an example for what we can do moving forward. But overall, 46 out of the 54 countries are off track, therefore reiterating the urgency for us to accelerate these reforms. Under 5 mortality rate has fallen. We've done some good things here, from 85 per 1,000 in 2015 to 76. Neonatal deaths have also improved from 29 per 1,000 to 27. And we've had pretty good progress on both health and education, although many countries in Africa still are not able to carry out on a regular basis demographic health and national surveys. This, I apologize if you can't see this very clearly, but this is just a figure that's depicting the poverty and healthcare SDG projections in sub-Saharan Africa. And it's looking at stunting among children, malaria incidence, maternal mortality, which my midwifery colleagues spoke about so well in the previous session, and the under 5 mortality, sort of just depicting our current progress, the target that we need to meet by 2030 as part of the SDGs, and what will happen if we progress and if we regress. And you can see again, Africa is not doing well. I want to switch, having given you that bit of a background on what I think can help us meet these SDGs, specifically in my area of expertise, which is nursing leadership. International policy reports have suggested that if we develop nursing, it will help us achieve the SDGs, particularly better health, which is very important, SDG 3. But as you know, the SDGs cut across, in my view, not just at the SDG 3, but cut across all of them. When we talk about good health and well-being, it cuts across all 17. We can't meet any of the SDGs if we do not have good health. Greater gender equality, which is also very important, and stronger economies, which is particularly important for us here in Africa, where we have very weak, fragmented economies. Roughly 400 million people in the world do not have access to basic and essential health services. And this has been really clearly shown that it's as a result of having fewer nurses and midwives. Actually, 58% of the countries in the world have less than 40 nurses and midwives per 10,000 people. I was very heartbroken when I watched the video of midwifery that was shown by WaterAid, which was contrasting the global north and the global south. I have worked in wards like the one that was depicted. I have done the work that the nurse, the African nurse, was on the right-hand side of the screen. And I've done that myself for many years. And one of the things I want to bring to us is this difference between the global north and the global south, and challenge us to think about it critically in a way that is not condescending or patronizing, but is more collegial and collaborative. And the key thing I want to say from my perspective as an African, in order for us to achieve the SDGs, it has to be our own responsibility. I will give Rwanda as an example of good things that can happen in Africa if we take the bull by the horns, so to speak. And this is, again, sorry if the slide is not very clear, it's just showing Rwanda's immense progress towards the SDGs. Again, looking at the parameters of health, under 5 mortality, maternal mortality, looking at things like improved access to drinking water, improved sanitation, access to electricity, which is a big, big problem for us in Africa because we depend on the vagaries of climate for our electricity generation, and poverty, which often I always say whenever people say poor, it's equated with Africa. And what are the things that Rwanda has done so well? I'll talk primarily quickly touch on 6 key areas and tie this in to nursing leadership, which I think is very important, that if we are able to strengthen this aspect of nursing, then we'll be very well on track to meet our SDG targets and goals by 2030. Number 1 is national ownership and domestication of the SDGs. These SDGs should not be treated as a standalone project from New York, which often is what happens with the global north, shoving things down our throats in the global south without understanding our context, our history, and the challenges we face. However, having said that, it means that the countries in the global south also have a part to play in owning some of these issues and integrating them into our national plans and strategies, domesticating them and adapting them to our national context. I've lived in quite a number of countries in Africa. I'll tell you, Botswana is not the same as Kenya. Kenya is not the same as Rwanda. Rwanda is not the same as Uganda. And many times we are lumped as Africa and treated as one. In the case of Rwanda, this approach helped them achieve many of the MDGs by 2015 and has put them on track in many aspects to meet the SDGs by 2030. Number 2 is the ability to strengthen statistical capacity and monitoring. We need to strengthen our data in order to measure the SDGs. How can we know how we are doing if we don't measure what we are doing? So we need to build robust monitoring systems to be able to inform policymakers. We need to increase the ability to implement a lot of the things that were happening. And this implementation is looking at institutional capacity, both systems and human, and all the things that come there. The biggest challenge I find we face in Africa is the issue of governance. And without tackling this key issue of governance in Africa, we cannot at all expect to achieve anything significant with the SDGs. Critical, very important, mobilization of resources. Money talks, as the saying goes. And often in Africa, that is the challenge that we have. And even more so, SDG financing is a serious challenge. There was the Addis Ababa Action Agenda that was implemented in, I believe it was late 2018, but not a single one of those commitments that were done in Addis Ababa. Many times the countries in Africa say they do not have these resources. Our domestic resource mobilization is still low, and we have been, and still from the global north, the commitment of what we call official development assistance, the order to countries in the global south has not been done, and only and then the Addis declaration was asking to allocate 0.7% of the GDP for this, and this has not happened. However, in addition to not having enough money, African countries, when they do have enough money, still are not able to manage those resources well. So we need to improve things around tax reforms, increase our domestic revenues, reduce tax evasion, illicit financial flows, and a lot of the financial issues that beset Africa as a continent. When again I look at Rwanda, in the case of Rwanda, they've done very, very well in improving their business environment and increasing their foreign direct investment by almost fourfold. Fourth is human capital development and job creation. As much as Africa has the youngest and fastest growing population, we need to have a firm commitment to invest more in people. And this is very critical because a more educated population is healthier and more productive. And then last but not least, implementing the Africa Continental Free Trade Agreement, which presents an opportunity for us in Africa to accelerate the progress on the SDGs. And this is going to be done by expanding African trade. This is what the AFTA is for, or is aimed at doing, accelerating progress on investment, on job creation, all which will lead to greater economic and social development. But this can only happen if African governments work together. I want to talk a little bit about what I've mentioned in these 6 areas and relate this to nursing and why this is so critical in Africa. The first and foremost and most important thing, like I said earlier, nursing cuts across all the SDGs, not SDG 3. Nursing is critical, and more so nursing leadership, to achieving national targets, to looking at issues around non-communicable diseases, mental health, like somebody alluded earlier, universal health coverage, emergency preparedness. We are now facing COVID, we are battling Corona, we are under lockdown, we are struggling, so many deaths. I think yesterday the US hit the 200,000 death mark, which was not a good milestone to reach, and very, very sad. And to me, nurses play a big part in all of this, especially in Africa, where one, we have a dearth of physicians, and we have populations that are in rural, remote, hard to reach areas. I will direct each and every one of you in your free time, if you can just go and read the scope of the State of the World Nursing Report, which came out this year in April 2020, which goes into great depth around nursing and the importance of nursing and the contribution that the nursing and midwifery workforce has in global, and even, like my panelist said earlier, in planetary health. It will give us statistics which are very, very important around how we can harness this workforce and use it for the betterment of our planet. Nursing leadership is key, and here, like I said, we need to leverage the role of nursing leadership in Africa to consider, not just now in 2020, which is the WHO designated year of the nurse and the midwife, but also for the next 10 years as we work towards achieving the SDGs, to create a world where no one is left behind, and equitable and accessible healthcare for all populations become a global reality. I want to finish by saying that nursing leadership is key. We need to look at areas of primary care, primary health care moving forward, where nursing plays a vital role. Many countries in Africa are conflict driven, especially in the central part of Africa. And these conflict areas therefore have an impact on health. And often you find in these communities, the most healthcare professional that anybody in Africa is going to see is a nurse. So it's very important for us to leverage the role of nursing and midwifery as a profession in order to meet our SDGs. We have nurse-led models of care. The panelist before me talked about ophthalmology, and she said that a lot of this ophthalmic screening is now done by nurses and non-physician personnel, primarily nurses, again highlighting the role, the important role that nurses play. I want to end by asking a question to all of us. When I watched the slide by WaterAid, which was juxtaposing the global north and the global south, I want us to ask ourselves a question. I want to ask a question to the global north, that all these years where we've had a lot of overseas direct assistance to us in Africa, that in 2020 we can still see such a picture. What should be the answer, so that when we have this conversation 5 years down the line or 10 years down the line, the picture will be very different? Colleagues, I thank you for listening.
Thank you so much, Judy. That was really, really fascinating. Thanks for so brilliantly highlighting the work going on within nursing leadership initiatives to develop nursing and midwifery, and allowing countries to achieve this triple impact of improving health, promoting gender equality, as you say, and supporting economic growth, all in one. Nurses are really at the heart of health teams and are closest to the patients we serve. affording them a unique insight and role in providing community-based care. I think we can all appreciate that they're an indispensable part of the response to meeting the SDGs. You also raise a really important point about tailoring those SDGs to local circumstances. And I can sense your frustration, and it's definitely something we can talk about in the questions. The point that you raised about Rwanda not being the same as Kenya and Kenya not being the same as Botswana, and that's definitely an area for further discussion. In the interest of time, I'm going to move on to our next speaker. Thank you very much, Judy. I'm actually a little bit starstruck in introducing our next speaker. It gives me really great pleasure to introduce one of the most inspiring young voices of this generation, Vanessa Nakate. Vanessa is a climate activist from Uganda, and she's the founder of the Ugandan branch of the First Fridays for Future campaign and the Rise Up Climate movement. Her work includes raising awareness to the danger of climate change, the causes and the impacts, and amplifying the voices of young African activists. Vanessa spearled the campaign Save the Congo to highlight the continuing deforestation of the Congo rainforest, and she is truly an inspiring leader, and it is my great privilege to have her speak today. Vanessa, you're very welcome.
Thank you so much. I'm happy to be speaking to all of you today. I'm a climate activist from Uganda and looking towards the achievement of the Sustainable Development Goals. I personally believe that if we want to achieve the SDGs, then we have to take two important approaches, and one of them being the people-centric approach and the other being the rights-based. Look through the Sustainable Development Goals, you realize that they connect to the lives of the people, the rights of the people. As a climate activist, I have been able to see that climate change greatly affects every other sustainable development goal. I have been able to notice that we cannot achieve any of the SDGs without achieving climate change. I mean, starting from the very first one, eradicating poverty. How can we eradicate poverty? And yet climate change continues to push millions of people into poverty traps. I come from Uganda, and mostly those in rural communities, they survive on agriculture, on the food that they grow. But with the increasing rise in global temperatures, their farms are put at stake. They're at risk of losing their homes, droughts. So meaning that a family that would have been able to get out of poverty cannot do that if climate change disasters continue to affect them, continue to destroy their farms, continue to destroy their homes, continue to destroy their businesses. How can we be able to achieve zero hunger if climate change is pushing millions of people to a point of having no food to eat? We saw the locust invasion in East Africa that destroyed a massive percentage of crops, and people were left with nothing to eat. When the water levels of Lake Victoria rose in this year, many people's farms were. And when you come to communities, heavy and intense droughts, long droughts, their crops are being burnt. So how will they be able to feed their families if climate change they eat? We will not be able to see zero hunger if climate change of having no food to eat. Education. Most families are able to take care of their children from the sales that they make, probably from their crops that they sell. But climate change even affects that. floods, with the hurricanes. If a child finds a flooded river, since most of them have to walk to school, they won't be able to cross that river. Last year, I read an article that states when a family loses everything to climate disasters, many times they are forced to give up some of their children for marriage. Who else but the girl child? So early marriages, early and unwanted pregnancies, they face those risks. People need to understand this intersection. They need to understand the interconnection. We won't have gender equality. Communities in Africa have women take care of the food, the water, provision for their families. Many of them are exposed to walking very long distances to find water for their families in case of water scarcity. They're exposed to gender-based violence as they walk those very long distances. They're exposed to getting backaches. The girl child is at a risk of dropping out of school. So there is so much that needs to be understood when Sustainable Development Goals, the rest of the SDGs. We cannot achieve any of them. It's at risk. Life underwater is peace building is at risk. When you look at Lake Chad, Zambezi River, Victoria Falls, their water levels have lowered. Specifically Lake Chad, to 10th its size in just 50 years. But the population in this region continues to rise. The demand for the water continues to rise. This puts these communities at a risk of fights for who gets to manage the water sources, for who gets to access the water, meaning that there won't be any successful peace building without addressing climate change. That is why this issue is very personal to me. It affects every sector of our lives. Affordable energy, renewable energy, everything to climate change. This is the greatest threat that is facing humanity right now. This is the greatest challenge that is facing us right now. We have lost. We cannot give up now. We have to keep demanding for action. We have to keep speaking for the SDGs, for the lives of the people, for the planet, for the ecosystems, for the wildlife. What kind of world can really get us to see the Sustainable Development Goals achieved? I believe a kind of world that is resilient, that is equitable, that is sustainable, a world that will ensure that the people are happy, the ecosystems are happy, the wildlife is happy, and the planet is happy. A world whereby people can have access to the next life. A world where people do not have to struggle to access health facilities, to access food, to access water, to access shelter, but by using our voices, by using our resources, by using our positions to we need to create as much awareness as possible so that people continue demanding for the action from the leaders. We need to keep speaking truth to power. We need to pressure the leaders into having political will to take the action that we need. All along, we thought that leaders do not just in this pandemic to listen to the science. It only takes political will. So we have to keep pressuring them. We have to keep pushing them to have the political will to listen to the science of climate change and ensure that the people and the planet are put over the profits. Money cannot help us in a planet that is unhealthy. Who can be happy when there is so much air pollution around? We need to keep the fossil fuels in the ground. Exactly why they were kept in the ground. Why do we have to keep digging them out? That is what we have to make. We cannot serve fossil fuels at the dining table. And we cannot drink oil. Leaders must understand we cannot eat coal and we cannot drink oil. These are not our life support systems. The life support systems are in our that we have to do everything we can to protect. We have to demand for sustainable cities, resilient communities, improved agriculture systems, education of people, especially girls and young women. I believe that when girls and young women are educated, they make better decisions when they grow up. They choose to get married later on. They have fewer and healthier children. This left out of environmental circles, education of girls and women. Will be able to achieve the sustainable development goals. We have to believe together. We have to demand for justice together if we want to see the transformation. Do not be silent. Be part of the change. Be part of the transformation. Thank you very much for listening to me.
Well, thank you so much, Vanessa. If we were there in person, that would have received a resounding round of applause. Thank you for such an insightful and personal presentation. And I think I speak for all of us on the call today when I say that you really are an inspiration to young people across the world. You and your colleagues at the Youth for Future and Rise Up have shown that even the youngest in our society can evoke positive change and spark international action on environmental protection. As you say, this is indeed the greatest threat that our lifetime faces, and we need leaders to hear our words loud and clear, that the climate crisis is real, it is happening now, and that we must act immediately. Ladies and gentlemen, this afternoon has given us so much to think about. We've heard tell of how the Sustainable Development Goals have provided us a blueprint, a measurable and achievable route to poverty eradication and policy change based on a global cooperation between countries in the global north and south. Professor Gilbert used a really powerful phrase during her presentation, and although Professor Gilbert, you used it to highlight the changes needed in international eye care, I think it sums up personally perfectly this entire session and perhaps this entire conference very nicely. And you said business as usual is not enough. Whether that's the need for more sustainable future thinking healthcare systems that Renzo so passionately discussed, the need for continued campaigning to end the destruction of our rainforests, the urgent need to raise the profile and status of nursing, or indeed the need to include eye health as an essential health service across the world. Our speakers this afternoon have echoed the sentiments of many others. We are a long way off achieving the Sustainable Development Goals by 2030, and we need a renewed and concerted global effort if we are to eradicate poverty before then. We need to take into account both of the calls of this conference, healthy people and a healthy planet. And on that note, we now have some time left for questions and answers from the floor. Are there any live panelists that want to ask a question? Aidan? if you want to unmute yourself. Just.
Hiya. I had a question for Claire. So do you think that community partnerships in training that are commonly used to address NTDs, such as trachoma or onchocerciasis, can be expanded to these more chronic eye issues and to be adapted to better facilitate outcomes within these health systems?
I'm sure that they could. We tend to take rather a top-down approach and often underestimate the power of communities. And I was watching a film that was shown in the break about a health educator who was HIV positive, who was educating other people with HIV. And I think we're absolutely missing a trick. I really learned a lesson when I did a study in Nigeria on a traditional procedure for cataract surgery, which is called couching. And within 10 years, the same number of people were having couching for cataract as were having formal cataract surgery. And this is because they had a fantastic network of people who were finding people who were cataract blind and then putting them in touch with this traditional healer. 75% of the eyes were blind, so it's not good. But I think I completely agree with you. We're missing a trick by not engaging more with communities and the resources and influence that they have. Yeah.
Thank you.
We have a question for Renzo. Sorry, if anyone else has any questions, you can click on the participants icon on the Zoom screen, and there's an option to raise your hand, and it'll just let us know that you have a question to answer, or else you can just wave into the screen. The question for Renzo comes from Breda. Why not, Renzo, are you there? Yeah. Why not the One Health response under the 3 pillars and to link with eye protection and environmental health also? Is it more palatable for most people, I think?
Sorry, I am trying to recall the question from the chat box. I think I saw it. Why not One Health response to link with? So I think I'm guessing the question is One Health linked to eye protection and environmental health? Sure, I think, and I'm sure Professor Gilbert can expound on how eye health is also linked to animal health and environmental health. We only think that it's something that is under the ambit of ophthalmologists, of human doctors, but through a One Health approach, definitely there's room for seeing the interconnections. But I think my other interpretation to the question is, One Health, planetary health. There's so many terms that have been introduced over the past decade or so. Eco health. I think at the end of the day, they're all telling the same thing, and that is the need for a transdisciplinary approach to addressing human health in the 21st century. It's not anymore, and that's why I said, planetary health is a reinvention of public health, is an expansion of public health, and really planetary health, eco health, One Health. It's human health and health as a whole beyond medicine. And so it's an invitation to bringing different kinds of people together around the table.
I can see, thanks for that response there, Renzo. I can see Claire waving.
Yeah, waggling my finger. Thanks, Renzo. I found your talk very interesting indeed. And I realized when you were talking that much of what you were talking about comes under the pillars of health promotion. And this kind of raises the issue that in many, many countries, including the UK, public health is absolutely underemphasized as a profession, and there aren't a few roles. Maggie Thatcher said we don't need public health, etc. And yet if we had public health people who understand health promotion in city planning, in planning urban motorways, in architecture, if these people were planted everywhere, then they could bring a health perspective to everything that we do. So what can we do to raise the profile of public health? Is my question. It's a fascinating profession. I mean, it's so interesting, so broad, you know, it goes from top to bottom and sideways and upwards and downwards. It's just very, very fascinating. Anyone who's listening.
Yeah, I mean, Renzo, if you want to jump in as well on that.
Okay, okay. I thought that was a rhetorical question for the audience because obviously we need an entire conference to really think about, you know, reinventing and, you know, the renewal of public health and health promotion in the 21st century. Well, I just hope that the COVID moment is making us realize about the importance of public health. Public health is always about the invisible: clean air, clean water, you know, safe roads, things that we take for granted on a daily basis. And then now, because of COVID, all these that have been invisible for a long time have now been, you know, reminded to us the importance of, you know, hand washing, for instance, very basic. But now we realize that is our first line of defense. It's not the doctors, it's not the health professionals, it's not the vaccine. It's basic hand washing, cough etiquette. Again, very basic things. But also, I just want to, laud Judy, for her remarks. I think that we've over-medicalized the field of public health and even global health. And I want to make sure planetary health does not repeat the same mistake again. And in order to prevent the medicalization or over-medicalization of these, transdisciplinary approaches to health improvement, we need to make sure that the nurses are on board. I think they're even the more credible leaders, in this fight, in this movement. We've relied on doctors for health leadership for a long time. And, I'm part of that. I'm sure a lot of the doctors in the room also recognize that. But this is the time to bring more nurses and other health professionals, but also what I also call professionals for health. They're not healthcare professionals, but they are professionals that for sure have a huge potential to contribute to health. And those are the social scientists, the engineers, the psychologists, the social worker, agriculturists, etc. All professionals for the creation and promotion of health in this century.
I think that gives us a lot to think about on that. Kind of diverging away from that topic, because as you say, we could host our entire 2021 conference on this. But Amanda has a question, and I suppose it's open for the panel as well. So Judy, Vanessa, Claire, and Renzo, is disability outlined or included in the SDGs at all in terms of creating accessibility, equity, justice, and enabling people with disabilities to be involved in policy making?
Can I answer that one, Kieran?
Yeah, go ahead.
Our group is called the Disability and Eye Health Group. So we've got an equal number of people doing disability research. And I think I'm right in saying that disability is mentioned in one of the subclauses of one of the SDGs only, which is very disappointing. Yeah.
We do tend to have this sort of binary vision of healthy or not healthy. And it's kind of came up in the COVID discussion as well. And I'm sure we'll talk about this a lot more tomorrow in our session about COVID. But in terms of this evolving evidence of the so-called long COVID, so we sort of put people into a camp as sort of healthy or unhealthy. Yeah. Claire, we've got one more question for you from Paul, who said, thanks, Professor Gilbert. Regarding the association between road traffic accidents and vision loss, are there significant correlation with certain patterns of vision loss? And are there any virtual reality technologies that could test driving performance that have yet been validated?
That's a very good question. I'm not aware of what kind of visual impairment people are suffering from, but one would imagine if you've got glaucoma, where you could still pass the test because your central vision is good, but you've lost all your side vision, that would be pretty catastrophic. But I've not actually, wasn't part of this review, so I don't know the details of the different studies. And the second question is now, there are tests of visual function which are becoming much more automated, So for example, there's eye tracking software, which can be used to test whether people have got a full range of vision. And that's very quick and easy to do, but people find it very acceptable. So yeah, I mean, visual acuity, I think, is pretty, well, you can use visual acuity as well, eye tracking software for that. So the answer to your question is yes. Yeah.
Perfect. So guys, I think if there's no one else who's put their hand up for questions, we are about to wrap up the session. So just a few sort of announcements before we leave. Nadine's going to come on and speak to you about the rest of the conference and how you can get involved in that. In the meantime, there will be a link put into the chat box and a poll about filling out an evaluation about this session, and we really appreciate if you fill that out so we can improve and include things that you like next time, hopefully when we all get to meet in person. So I will now hand over to Nadine, who's the director of the Irish Global Health Network.
Great, thank you, Kieran, and thank you so much, each and every one of you. I'm sure I speak for all of us listening. I feel very, very inspired, and I feel very, very passionate about climate change and planetary health, and I've learned a huge amount. So, so thank you all. We'd love to just check in with everybody and just see how people are. So again, like we did this morning, just grab your phone if you can, grab your device and go to www.menti.com and just put in the URL menti.com, and then you will enter the code that you see on the screen, 7261541. And as soon as you've done that, you'll be able to see a question. We have a question for you. So we'd love to know, it's, we're all sitting in our homes and in different spaces. How are you feeling at the end of the first two panels? How many people are feeling tired? How many people are feeling energized? Okay, good. We're looking inspired. So the inspired bar is moving. Wonderful, interested, energized, relieved. We have some tired people, understandable, sitting online, sitting on the screen as we are. Wonderful. Great. Okay, thank you. Good to know how you're feeling. And then just moving to what did you learn today? What's the main take-home message that you're taking away with you from the sessions today? And you might just try and limit your words to maybe 2 or 3 words. Climate, climate, climate. We can do this. Yeah, lots of learning. There's hope for change. So much, absolutely overwhelming. Everything is connected and interconnected. Importance of climate, interdisciplinary planetary health. Wonderful. Yeah, wonderful. So we can see a lot more underneath. Wonderful. Okay. And then lastly, just a last question for everybody. What action, if there was an action that you would take based on what you heard today? We've heard the young voices of Vanessa, of Reno. We've heard so many wonderful speakers. What action would you take based on what you heard today? Get involved, activism, learn more, work. Yes, leadership, read up more, absolutely. Political activism. I like that one. Think futuristic. Advocacy. Wonderful. Commit. Yeah, you can see get involved is bigger and bigger. So many people are choosing that. Research. Keep advocating. Tell everybody. Share knowledge. Spread awareness. Wonderful. Discover more. Collaborate. Good, excellent. We need this kind of energy and we need this kind of action. So, so wonderful. Thank you, everybody. And from me, one of the things I'm taking away, I heard it, Vanessa, very clearly. What you said was, "Do not be silent. Be part of the change," and that really, really resonated with me. So as we come to the end of our second panel, just a few little housekeeping things. If you have any comments, we really would like to know what you think. There's going to be an evaluation put in the chat box. If you could click on the evaluation and just take 2 minutes to fill that out, we'd be really, really grateful. If you'd like to continue the conversation, which I'm sure many of you will, each of the speakers has agreed to join us in Speaker's Corner, and they will be there for 10 minutes. So just as you would grab them as they were coming down from a podium after speaking, you'll be able to grab them in a Zoom room. And the chat, again, there's a link in the chat. You just follow the link and you choose the speaker that you want to join, and then you'll enter into a room to be able to speak to that person. We'll be back again later on today with a session, and that session is for students and early career professionals. And I would actually challenge that it's actually for all of us, as we're all needing to pivot and continue to reinvent ourselves. It's called Post-COVID Global Health, the New Reality for Young Professionals. The session is going to start at 5 p.m. Irish UK time, and it will run for 2 hours, and it will be on the same link that you have received for the main conference. And just last reminder, for those who need CPD certification, please email, and the email is also in the chat box. So we will see you tonight for the Young Professionals Side event at 5 p.m. And other than that, we will see you tomorrow at 11 o'clock for panel 3. And for those of you who are joining our speakers, we look forward to meeting you in Speaker's Corner. Thank you.